Hello, my name is Dr. Dewan S. Raja. Today I will discuss about multiple choice questions on the splanchnic nerves. We'll go through the thoracic splanchnic nerve, lumbar splanchnic nerve, sacral splanchnic nerve, and the pelvic splanchnic nerves. Let's start with thoracic splanchnic nerve. Number 1. A 45-year-old male presents with complaints of severe postprandial epigastric pain radiating to the back. He has a history of chronic alcohol use. Imaging reveals acute pancreatitis. The pain is attributed to autonomic nerve involvement, which nerve carries the majority of sympathetic pain fibers from the pancreas. A. Greater splanchnic nerve. B. Lesser splanchnic nerve. C. Least splanchnic nerve. D. Vagus nerve. So, which nerve carries the majority of sympathetic pain fibers from the pancreas? Answer should be A. Greater splanchnic nerve. Question number 2. A 60-year-old female with a history of hypertension presents with episodic palpitations, headaches, and diaphoresis. Imaging confirms a pheochromocytoma in the adrenal medulla, which thoracic splanchnic nerve is most responsible for carrying preganglionic sympathetic fibers to the adrenal medulla. A. Greater splanchnic nerve. B. Lesser splanchnic nerve. C. Least splanchnic nerve. D. Vagus nerve. Answer should be what? The lesser splanchnic nerve. B is the answer. Lesser splanchnic nerve. Question number 3. A 35-year-old patient undergoes a thoracic sympathectomy to treat severe hyperhidrosis of the upper limb. During surgery, the surgeon aims to spare the thoracic splanchnic nerves. Which of the following autonomic ganglia does the lesser splanchnic nerve primarily synapse in? We have the choices: celiac ganglion, B. superior mesenteric ganglion, C. inferior mesenteric ganglion, D. otic ganglion, E. pterygoplatean ganglion. Answer should be what? Answer should be superior mesenteric ganglion. B is the answer. B. Question number 4. We have that. This is the question. A trauma patient presents with a T12 vertebral fracture and develops severe pain and autonomic dysfunction related to the kidneys. The least splanchnic nerve is suspected to be involved. Where does this nerve primarily synapse? Choices are celiac ganglion, B. superior mesenteric ganglion, C. aortic-renal ganglion, D. inferior hypogastric plexus. Answer should be what? Where does the least splanchnic nerve primarily synapse? Okay, answer should be C. aortico-renal ganglion. 4 answers should be C. Question number 5. A medical student is dissecting a cadaver and identifies thoracic splanchnic nerves. Which statement correctly describes these nerves? They carry postganglionic parasympathetic fibers to the abdominal organ. They carry preganglionic sympathetic fibers to the prevertebral ganglia. They synapse in the sympathetic chain ganglia before reaching the abdominal organ. They originate from the cervical spinal segment and innervate the diaphragm. So what is the correct answer? Is it parasympathetic? No. Is it sympathetic? Yes, but they do not synapse in the sympathetic chain of ganglia. They carry preganglionic sympathetic fibers to prevertebral ganglia. Answer should be C. And they does not originate from the cervical spinal segments and does not innervate the diaphragm, but they passes through the crus of the diaphragm to the abdomen. Okay, so answer should be C. C is the answer. Question number 6. A 65-year-old male with a history of chronic constipation and fecal impaction is diagnosed with chronic inertia due to autonomic dysfunction. Sympathetic innervation to the hindgut is compromised, which autonomic ganglion receives preganglionic fibers from lumbar splanchnic nerve to regulate colonic motility. Choices are celiac ganglion, B. superior mesenteric ganglion, C. aorticorenal ganglion, D. inferior mesenteric ganglion. So what is the choice among them? So we are here hindgut. So here answer should be inferior mesenteric ganglion. Inferior mesenteric ganglion. D is the answer here. Question number 7. A 58-year-old male presents with urinary retention and difficulty initiating urination. He has history of diabetes mellitus with autonomic dysfunction affecting the lower urinary tract. Sympathetic fibers from lumbar splanchnic nerve regulate bladder function. What is their primary effect on bladder? A. Relaxation of the detrusor muscle and contraction of internal urethral sphincter. B. Contraction of the detrusor muscle and relaxation of the internal urethral sphincter. C. Stimulation of micturition reflex by acting on pelvic splanchnic nerve. D. Inhibition of external urethral sphincter. What is the role of sympathetic fiber in the lumbar splanchnic nerve to regulate the bladder function? Number 7, answer should be what? Answer should be A. Relaxation of the detrusor muscle that is present in the wall of the urinary bladder. This is smooth muscle. So relaxation of the detrusor muscle and contraction of the internal urethral sphincter. Okay, there is also smooth muscle. Number 8. A 52-year-old male presents with erectile dysfunction. Neurological examination suggests dysfunction in the sympathetic outflow to the pelvic organs. The sacral splanchnic nerves are suspected to be involved. What is the role of these nerves in male sexual function? Sacral splanchnic nerve. A. Initiation of erection by vasodilation of the penile arteries. B. Contraction of external urethral sphincter during micturition. C. Relaxation of detrusor muscle and facilitate urine storage. D. Ejaculation by contraction of vas deferens and internal urethral sphincter. So, what is the right answer? Number 8. 8 answers should be D. Ejaculation by contraction of the vas deferens and internal urethral sphincter. D is the correct answer. Question number 9. A 70-year-old female presents with fecal incontinence following pelvic surgery. Imaging reveals damage to autonomic fibers involved in rectal control. The sacral splanchnic nerve contribute to which of the following actions related to defecation? A. Relaxation of the internal anal sphincter. B. Contraction of the internal anal sphincter. C. Stimulation of peristalsis in the sigmoid column. D. Activation of the parasympathetic fiber in the pelvic splanchnic nerve. Okay. So fecal incontinence, 70-year-old female damage to autonomic fibers involved in rectal control. Sacral Splanchnic nerve contribute to which of the following action? Number 9. These are the choices. Number 9. Okay. This is the choices. So answer should be contraction of the internal anal sphincter. Contraction of the internal anal sphincter. This is sympathetic. Okay, this shouldn't be confused with that of the pelvic splanchnic nerve. So question number 9, answer is B, contraction of the internal anal sphincter. Number 10, a 45-year-old male presents with urinary retention and difficulty in voiding. Aerodynamic studies show an inability to contract the detrusor muscle. Damage to which of the following nerve is most likely responsible for this condition? A. Sacral splanchnic nerve, B. Lumbar splanchnic nerve, C. Pelvic splanchnic nerve, D. pudendal nerve. Number 10, answer should be what? What is the answer? Number 10, answer should be pelvic splanchnic nerve. Okay, that is essential for the contraction of the detrusor muscle. And detrusor muscle is present in the wall of the urinary bladder. Question number 11. A 60-year-old male presents with erectile dysfunction. A neurological examination suggests autonomic dysfunction affecting the parasympathetic system. Which nerve is responsible for initiating penile erection? In penile erection, we need more blood flow to the vascular spaces in the penis around in the corpus cavernosa and corpus spongiosum. Okay, which nerve is responsible for initiating penile erection? A. Hypogastric nerve, B. pudendal nerve, C. Pelvic splanchnic nerve, D. Sacral splanchnic nerve. What is the answer? Answer should be C. Pelvic splanchnic nerve. Question number 12. A 70-year-old female with chronic constipation undergoes colorectal motility studies. Findings suggest impaired peristalsis in the sigmoid colon and rectum. Dysfunction of which autonomic nerve is most likely responsible? A. Lumbar splanchnic nerve, B. Pelvic splanchnic nerve, C. Sacral splanchnic nerve, D. vagus nerve. Answer should be B, that is the pelvic splanchnic nerve. Okay, there is essential for peristalsis in the colon, like sigmoid colon and rectum. Question number 13. A 58-year-old male undergoes radical pelvic surgery for rectal cancer. After surgery, he develops fecal incontinence due to loss of internal anal sphincter tone. Which nerve is responsible for relaxing the internal anal sphincter during defecation? So, relaxing the internal anal sphincter. Answer should be A. Pelvic splanchnic nerve. With other choices, sacral splanchnic nerve, pudendal nerve, lumbar splanchnic nerve. But our answer should be pelvic splanchnic nerve.